This. All right. So we're live. This is Dr. Nelson with Kids Health, live streaming in the afternoons. Usually we're here Tuesdays and Thursdays at 3 p.m. And today we have, all right, uh, sorry about that. Uh, Today we have Coach Bronson Dant. Uh, he's been gracious enough to be here today. And if you have any questions, put them in the chat. Tell us where you're watching from. I am in Central Florida. Where are you at today, Coach?
Northern Virginia.
Okay. So
right
we're
around
both
DC.
Eastern time.
Mm-hmm.
And if you don't know who Coach Bronson is, I'm going to tell you in a little bit.
How can anybody not know who I am?
Most of the people we get here, I'm pretty sure they know. Coach Bronson didn't start his fitness journey until his late 30s, being 70 pounds overweight with urgent bowels and health issues. Now at 53, he's transforming his life and fitness with proper nutrition. Bronson has spent over a decade coaching and helping people. He emphasizes that body confidence goes beyond aesthetics. It's about improving what your body can do. His mission is helping others achieve personal independence. Very appropriate for Independence Day weekend, right?
Yeah, right.
And say, yes, I can to life's challenges. And Coach Bronson has a bunch of little letters behind his name.
There's a lot of them, yes.
He can explain what those are, but we share one set of letters, which is MHP. We're metabolic health providers certified by the Society of Metabolic Health Practitioners. So we share some of the continuing education efforts that we do. How long have you been a member of the Society of Metabolic Health Practitioners?
Going on a year.
Okay.
Yeah. Followed it for a long time, just with all the other things that I'm doing. I'm finishing a master's degree. I'm getting ready to start a doctorate in August. So joining another association wasn't really on my list of things to do. But Dr. Tro talked me into it last year, actually. So
I think they provide a lot of value.
Yes.
Sorry about that. A lot of value. They
Absolutely.
do have multiple courses in conjunction with the Nutrition Network, and they themselves provide the grand rounds, multiple meetings. On their website, you can find practitioners all over the world that are practicing a low carb ketogenic type of practice. They have a lot of resources. So I find that is worth the time, money, and they do have a lot of information. So if you guys have any questions, we're going to start talking. But as you come up with any questions, please put them in the chat, QQQ, before that, so I can catch it. I don't have anyone else helping me today here.
I'll try to keep my eyes out too.
If you see a question there and you want to just shout it out and answer it, that's not a problem. We're pretty flexible here, relaxed, and we'll be happy to try to answer all these questions. But why don't you tell us a little bit about you and your journey, because you do have a story that does involve basically low carb ketogenic diets. And we're at Kids Health, we are mostly carnivore, but keto, carnivore is all good. Listen, if you want to be in ketosis as a vegan, you can. It's very difficult, right? It's just,
Absolutely. Not a way I would recommend.
yes. But, we can try. I have a diet for that, and we're doing a certification course, and we'll be teaching how to coach people who want to do it being vegan. I'm not
Mhm.
going to spend too much time with that because I don't think it's worth the effort. But hey, some people insist on that
You
way.
gotta be able to meet everybody where they are, right?
Exactly,
Yep,
exactly.
for sure, for sure.
So personally, I've been vegetarian in the past, many years ago. I've done the standard American diet,
Mhm.
standard atrocious diet, I call it. I've done keto, the old Atkins diet multiple times. I should be ashamed to say it, but I say it because this is what I did. I lost 40 pounds, then went back to eating the way I was eating because I had achieved my goal, right?
Mhm.
So this past weekend, it was 2 years. Well, 2.5 years that I had gone very strict keto. And then last Sunday was 2 years carnivore,
Okay.
where I have been able to reverse my diabetes, my hypertension, and a bunch of other minor, but those two are big
Yeah,
ones. And this guy was using 300 units of insulin a day
that's crazy.
and very high doses of antihypertensives. I don't use any of those anymore. Chronic pain, plantar fasciitis, a little eczema, gastroesophageal reflux, nail fungus, toenails. One toenail used to had a fungus there for several years, and I just disappeared. I didn't even notice when.
Hmm.
A bunch of improvements. And by the way, today I had some fat trimmings that I had brought up. That's all I've had today. But go ahead and tell us about Coach Bronson and how you got to where you are today, please.
Yeah, yeah. So, like you said at the beginning, I got started in this process in my mid to late 30s. I realized that I needed to make a change. I was overweight. I had done the normal thing, right? Started a family, got a desk job, and just kind of sat around and didn't do much of anything else. Um, I started like a lot of people because I didn't like how I looked, and I felt like I needed to make that change and do things to look better. So for me, I had a natural inclination to start with fitness. I started with fitness. I got into CrossFit. I became a CrossFit coach. I ended up opening up a CrossFit gym. I lost a ton of weight. I got into really good shape, but I didn't heal anything. The issues that I had when I was overweight maintained, and some of the things actually got worse. I actually had a higher rate of injury. I had, tore more things. I had torn meniscus in my knee, torn labrums in my shoulders. All of these things that were happening that were making me not able to train, not able to be physical. On top of having urgent bowels and having IBS, and my life being completely controlled by how how quickly I could identify and get to a bathroom if I needed to. All of the decisions in my life being made by whether or not I would have access to a toilet, right? I had to say no to a lot of activities in my life because I couldn't go out and just be out in the middle of the woods for multiple hours at a time because I needed a bathroom. I couldn't take long road trips. I couldn't do a lot of things. And so it was very restrictive in the way that I was living my life because of my bowels. So I started looking at options initially from a nutrition perspective to help with my bowel and my digestive issues. I did not start the carnivore diet to lose weight. I was already in pretty good shape. I did not start the carnivore diet for any other reason than I need to try something else, anything possible, so that I would stop crapping myself all the time. That's literally why I started it. And go figure, several months into the carnivore diet, I stopped. It got better. All those issues that I had, all that stress and anxiety and concern, um, probably in the first 90 days, it actually went away. It took me about 6 months to really realize that something was different. Because I lived literally for decades with this just being how my body was. That it took me several months to realize, wait a second, all of the things that I'm doing to prepare for the inevitable the inevitable is not happening anymore. I don't have to do all of these things. I don't have to go through all these extra steps. I don't have to have all this stress and anxiety. I can actually go on a hike and be gone for multiple hours. And even if I felt like I had to go to the bathroom at any level while I was on the hike, I could hold it until I got to a bathroom. It wasn't the minute I have the urge, it was urgent and immediate, and I didn't have any other option. I was going right then, no matter what, which is how my life was. There wasn't a single time for decades of my adult life where if I felt the need that I could hold it. If I felt the need, it's because it was happening right then, right? There was no in between. It was on or off, you know? So now I'm at that point where, you know, you get that little feeling like maybe you eat something or you've been, you know, it's been a while since you've eaten something and you're like, oh, I think I could probably go to the bathroom, but there's nothing around. Most people don't feel pressure. They don't feel anxiety when
The
that happens.
urgency.
Urgency, right? And I've gotten to that point now where I can be in the car in traffic and be like, okay, well, whenever we get someplace where I can stop, then I'll go, as opposed to trying to weave in and out and pull off on the side of the road and get into an accident because I got to get somewhere as fast as possible, or I'm going to do it in my car, right? That is a whole. It's really hard for me to even describe to a lot of people how much of a relief and freedom that you gain from not having to do those things. So
And
that's why,
sorry to interrupt you, but
yeah,
uh, I do understand you completely, because in 2018 I had a stroke, and after my stroke, for a certain amount of time, I was in the same situation. The
yeah,
moment I felt like just the minimum amount of, okay, I gotta go, I better get to a bathroom quick, because
exactly.
otherwise I was going to have an accident.
Yep.
And it's not, it affects you in so many levels, of course. Not something you want to do in front of other people, and just a whole host of
A whole host of it's gotten to the point now where I got in such a habit of always driving myself that I don't now, even when I don't need to, it's like I'm still driving myself. Like I just got into this routine and habit of whenever we're going somewhere, because I need to be in control of where the car is going,
yeah.
I'm always going to drive myself, no matter where we're going, right? And you know, it was really bad.
You even get to the point of identifying that, at least I have done, which chains of gas stations and establishments, the bathroom is going to be pretty clean, and which
Yeah,
ones
or at least
are not.
available. Yeah. Yes, absolutely. Um, so that's why I started. One of the cool things about once I did it, you know, I also noticed that some of the other issues I was having, obviously, it became easier to manage my body composition. I was able to lose body fat and not lose muscle. So from a fitness perspective, that was really fantastic, because that was one of my big struggles in the fitness side of things. Is anytime I wanted to get more lean, I got weak because I would lose muscle at the same time. And then anytime I wanted to build muscle and get strong, I would also get fat. And I didn't think that there was any other way to do it until I found the carnivore diet. Um, but the really most impactful, I think, from from the fitness perspective, is all of the aches and pains that I had went away. You know, all of the pains that you get from just age, which are really just your body breaking down because you're not treating it well. My ability to do exercise and then recover well and faster just increased incredibly. So I went from doing two or three workouts a week and feeling like I got run over by a bus, to where now I can do 4, 5, 6 days a week and I feel fine at 53 years old. So being able to perform at that level with that consistency now without feeling like I'm going to get hurt all the time has been absolutely fantastic. And then the actual injuries that I have, I won't say that they've healed, but I don't feel them anymore. So I have a torn meniscus in my knee. I never got it repaired. It doesn't bother me anymore. I've had both my shoulders have torn labrums, both have slap tears, right? I've not got them repaired, but they don't bother me anymore. I've got herniated discs in my neck, C3, C4 through C7. Not a problem. They don't bother me. They're still there. Never got them repaired, but I don't have to worry about them because, number one, I've reduced the overall inflammation in my body, so they're not always stressed out. And then number two, I've taken the time to build strength in my body so that they're not being focused on as a source of weakness. So,
And that is very important to point out that you still have those. I, I am older than you by a few years, and of course had my share of problems on the spines. I had back surgery. I have
mhm,
multiple herniated discs and pains. Pain went away. I didn't even realize when the chronic pain from back problems
yeah,
went away the moment I went carnivore. By the way, not, they went away a little bit with a strict keto diet,
mhm,
but once I went carnivore, it was quickly chronic pain, plantar fasciitis. I had on and off for um 35, maybe 40 years.
yeah,
And I would always say, nobody dies from a plantar fasciitis, but it hurts.
it hurts, right? Yeah,
And multiple herniated discs, pinched nerves. I don't have chronic pain. If I exercise a little bit, I'm sore the next day, maybe a little bit. Or when I get up in the morning,
hmm,
stiffness a little bit, it goes away within minutes, but no longer that chronic pain where I had to be taking medication,
right.
which in over 2 years, maybe I've taken a couple of times some anti-inflammatory pain medication, and I think most of those have been for a tooth problem, actually. Uh, so we got a couple of questions already. So
Sure.
let me just got from the back from the doctor with my mother. She has been on carnivore for 4 months. Blood pressure was super high. Her LDL is over 250. The doctor wants to put her on statins and back in blood pressure medication. Hard to keep this. I don't know if there's any second part.
You said
Um,
something about he mentioned you and Dr. Kiltz, I guess, and the doctor said not to listen to what you had to say.
yeah, that's I'm gonna address that in a moment. The blood pressure, my experience has been most people that go on either very low carbohydrate diet, ketogenic diet, on the 20 or 30 grams of carbohydrates a day, blood pressure gets better. And that is the experience that, you listen to, for example, Dr. Eric Westman, who's been doing this for a long time. Blood pressure gets better.
Yep.
However, the longer you've been hypertensive, the more likely you'll be to continue to have problems with blood pressure, because blood pressure causes damage, uh, increase your risk of atherosclerosis, hardening of the arteries. So the longer you've had hypertension, the more likely is that you're gonna have to stay on medication. So uh, I'm not your doctor, you're not my patient, but if your blood pressure continues to be high, my opinion is you probably need to listen to your doctor as far as
Yeah.
continuing blood pressure medication. I was able, I, it was 2018 the first time I started taking blood pressure medication, actually. 6 months later, I had a stroke, but I had not needed blood pressure medication. So when I went uh, very low carb or carnivore into 2023, I think it took me 7 months tapering down, and I no longer have problems with blood pressure. My blood pressure usually is in the teens or 120s most of the time. I don't need it anymore, but that
Yeah,
doesn't mean,
that's a good point. There's a process of deprescription that I think people need to think about. It's not I'm going carnivore, this is going to fix everything, so let me just stop all my medication, right? You need to show that you don't need the medication anymore before you just stop it.
yeah,
And that's a
yes,
process of slowly, like if you have blood pressure medication that's supposed to keep your blood pressure low, if it starts getting too low, then that means maybe you don't need as much. So then you drop the dosage until you get back to normal. And then maybe over time you start healing and you don't need it. You start getting too low and then you drop the dosage again, right? So there's a process, like you said, of weaning yourself off of these things.
yeah.
I hope people aren't just saying, hey, carnivore is supposed to fix everything. So let me just stop right out the gate,
Yeah, don't do
right?
that, because you know your blood pressure being high, especially if you take it at home. I
Yeah.
always tell the patients when it's high and they say, oh, it's always high at the doctor's. Well, that might be. Check it at home, keep a log, bring it back
Yep.
in 2 weeks. We'll see what it is.
Yeah.
And if
Yeah.
they show to me that the blood pressure is usually normal, except when they come to the doctor, great. Your blood pressure at home is great, no problem.
Yep.
But it can uh, increase your risk significantly of having a stroke or a heart attack. And the longer, I mean, if you've had hypertension for 30, 40 years, I really would doubt it that any change in lifestyle is going to have an impact such that you won't need it anymore. I'm pretty sure most patients will be able to decrease or eliminate some of the medications. The LDL is another story. It could take us a whole a couple of hours, probably talking. Uh,
If
total
that was
cholesterol.
if that was my LDL, I wouldn't. I'm not worried about it.
Yeah.
That's all I'm going to say.
Like Dr. Obadia says, it's more important the quality
Yeah.
of those cholesterols, the lipoproteins, and you want to know the fractionation. If you are into the numbers, then the best thing is to do an NMR lipoprotein fractionation and see what your particles look like, because sometimes your LDL may be elevated, but they are all big, fluffy particles which are not atherogenic, or they could be small and dense.
Yeah.
So it
Also,
does
what's the triglycerides in HDL, right?
that.
It's the
That is
whole
probably
this is the challenge I have with doctors specifically, and even not even just doctors, but in general, when you especially when you get influencers who are trying to be biohackers and they focus on one metric out of 3 dozen options of things that we could be looking at. And like, well, this number is off. So you need to optimize this number. It's like, well, that number, when you look at this and this and this and this, that number doesn't mean anything. What are you talking about? So it drives me crazy. It drives me crazy.
and if you were to believe all the LDL cholesterol talk, then you need to take this into consideration. If you do a list of conditions and blood tests that are significantly uh, increasing your risk for cardiovascular events, I have such a list, and I have 10 things that are more important than the LDL cholesterol. Guess what's at the very top of that list? Diabetes and everything that relates to blood sugar.
Yep.
And the HDL and triglycerides are more important than the LDL. So, in isolation, you cannot do that in isolation. Guess what's more important? That you're not a smoker, that you are not inactive,
Yeah.
uh, which
Yeah.
is one
Do
of the
you,
things
in
we
this
can talk about.
community, Dr. Nelson, in this community, do you guys talk about glycemic variability a lot?
Some,
Some. I think that is highly under discussed.
yeah. You don't have to be diabetic, and if your blood sugars are skyrocketing and coming
And
down
then
quickly,
going down, if
even,
you're going up and down
yeah,
dramatically, if you can have a perfect A1C, you could be a 5.3 in your A1C your entire life. But if your glycemic variability is at a 10, then you are at a higher risk than somebody who's at a 6.0 A1C. So glycemic variability actually is more strongly correlated to metabolic dysfunction than A1C is. And that's a super impactful thing that because we haven't had the ability to track variability, right? So now that we have CGMs, now that we can have our continuous glucose and we can actually look all day long, the ups and downs, we can start tracking our glycemic variability. And if anybody's interested in looking it up, the acronym is MAGE. I think it's mean amplitude of glycemic excursions, if you want to look that up. And if you look into what MAGE is and how it works and start looking into the research, you can see that that's a marker that, especially aligned with some other things, you can say, hey, this is, even if your A1C looks great, you might be at a higher risk than you think you are.
So this is the second part of the comment. When we mention you, he said, "Stay away from social media influence doctors." Wh- Who are we supposed to believe? Well, I am not a social media influencer. Okay.
You're the number one.
Yeah. Uh, I've been a doctor for 40 years. This year, the end of the year will be 41. Two things this year will be 41. In just 12 days, I've been married 41 years.
Wow.
And in about 6 months, I will be a doctor for 41 years. So I've spent my life practicing medicine, and I've been just a few months appearing on people's YouTubes with Dr. Kiltz. But I think the comment was not made probably about me or Dr. Kiltz specifically. It was made about all social media doctors. And what I would say is, you see this little thing you carry around? You have more information at the tip of your fingers than I had when I went to medical school. Okay. When I went to medical school, which was between 81 and 84, I was reading books that they were probably already 10 years behind, and I had to go to the library to research a project which would take me months and months if I was doing some deep research. And I was reading things that were 10 to 20 years already old. Uh, you have do your research. Don't believe us. Do
Yeah.
your research, and there is a paradigm shift on the thinking behind saturated fat, total cholesterol, and all that. And even though it's difficult sometimes to identify what's the truth, uh, there is so much information out there.
And what's applicable. And Bill Cook said, but Google is not always correct in his comment. And I want to highlight that because I think it kind of gives us a window into the way people think about searching for information. We do not Google information, or we do not Google things to get the answer to something. If you're Googling to find the answer, then you're already starting on the wrong foot. We Google to get information, then we have to use our critical thinking skills to determine if that information is reliable and applicable to what we're trying to do. So the internet cannot answer your questions. The internet can give you information that you then have to figure out the answer from the information. So this is a process that you have to be actively involved in from beginning to end. Just want to make sure that's clear.
And one of the big examples we can point at is these new studies on LDL, the lean mass heavy responders, Dave Feldman, and all the
Mhm.
people that are doing this. Because many of the studies that have been done in the past with LDL do not apply to someone who's following a very low carbohydrate diet or carnivore diet.
Correct. Yep.
Because you have to, and Dr. Westman likes to try to impress on people within what context. I mean, was
Correct.
this
Context is everything. Yeah.
so? If you're going to measure LDL on someone who's having a very high carbohydrate diet, then that's not applicable to someone who is in a very low carbohydrate
Correct.
diet.
Yep. Yep.
And you cannot draw the same conclusions and all that. All right. So, and by the way, don't believe me. Go and do your research if you want information about. There's already hundreds of LDL cholesterol studies. By the way, ketogenic diets are probably the most studied diets over 100 years. It's just that they don't, you know, you don't get to find a specific medicine you can market out of most of those studies.
Yep.
So pharmaceutical companies don't pay attention to it.
Yeah, they don't. And actually, I've been working on a couple different papers, and I've done some research in just how much research has been happening in the ketogenic space over the last 20 years. This is amazing to me. The last 20 years, 60% of all of the ketogenic research has happened in the last 5 years. So from 2020 to 2025, if you go look at all of the research of the last 20 years since 2000, 60% of it's happened in the last 5 years. Thousands of studies in the last 5 years on the ketogenic diet. And that doesn't even count the studies that are currently active right now.
The feral grandma asked, Dr. Nelson, when it comes from a stroke, isn't it called neurogenic bladder or bowels? You can, neurogenic bladder has a specific definition, and the problem may have been, in fact, initiated from a stroke, but it could be from other causes, so it's not unique. But in general, people who have strokes, not all, by the way, not all, but because it depends where in your brain it happened, may affect bladder and bowel functions. And so that's that. If you have any other questions, please put them. I wanted to ask you, you mentioned muscle in a comment just a couple of minutes ago.
Yeah.
Most of the people who are in this space, unfortunately, I say unfortunately because we don't get too many young people in this space. Most of the time, most of the people are looking to solve a health problem, and they ended up on a low carbohydrate or carnivore diet
Sure.
out of basically necessity. Even the doctors that are in this space, just listen to them. All of them, maybe the exception is Dr. Westman, but like all the ones that I know, I've seen, they had a personal problem as well.
Mm-hmm.
And they found themselves, okay, wait a second, let me study this because this is surprising. They didn't teach me this in medical school, and they end up promoting this way of living, of eating, and other lifestyles. It's not
Yeah.
only about diet, but diet is such an important aspect, I think, because even though you need to watch out for sleep, exercise, stress management, and all these
Mm-hmm.
things, if you don't include a change in your diet, all the other things seem to be a little bit less. Not they're not insignificant.
Mm-hmm.
For example, exercise. You cannot out exercise a bad diet,
Correct.
but you don't. You know, some people are able to lose weight. When I was like this, I wasn't able to even exercise. Period. I
You
was on my
were.
way to.
You were
Well,
actually.
well, I understand that getting up from the chair is an exercise,
Absolutely.
but in the not going to go and lift weights and do things, but I was falling. I was almost in a wheelchair.
Yep.
I had to go to physical therapy.
Yeah.
Uh,
There is
fortunately,
never a person that is too overweight to exercise.
so I was fortunate enough that I had an excellent physical therapy assistant. It was one of my sons. But anyways, my amount of activity I could do was limited. Let's put it that way. It
Sure.
wasn't that I wasn't able to exercise, but this difference from here to here was mostly without exercise.
Absolutely.
Once I got here, I was able to increase the amount
Sure.
of exercise. So, uh, all this to say, to ask you, let's take an average, 50 years, 60, 70, 80. Uh, I think we need to do two things. At the very least, avoid losing muscle mass.
Mm-hmm.
So, what someone who is past 50s, getting 60s, 70s, even 80s, what type of activity, movement would be advisable for someone to at least avoid losing or maybe try to increase muscle mass?
So there's two things I want to address. Number one, we need to redefine what exercise is. And then number two, we need to redefine what the expectations are. Okay, so first of all, exercise is any activity that is done with the intent to improve physical ability. That is exercise. There is no expectation that it requires equipment, a gym, or anything else. Anything that you do with the purpose of improving your physical ability, increasing your personal freedom, is exercise. You're training to improve what your body can do. Okay. So that's the first thing. There is no expectation or limitation on how that looks for any individual person. I don't care if you're 400 pounds, there is something that you can do to improve the physical ability of your body. Okay. So that's the first thing. I want to make sure everybody is 100% clear. There is no limitation. Do not ever limit yourself because you don't think you can do something. There is always something that you can do to improve what your body can do. Number two, the age of a person getting started is not a limitation, it is an opportunity. There is no such thing. There's no need to look at this as what should they do to maintain. You're beyond maintenance. You have to improve. If you haven't been doing something for 10, 15, 20, 30, 40, 50, 60 years to improve your fitness, you have an obligation to yourself to start doing something to get better. We're not trying to maintain. You're already in the hole. The goal isn't to stay in the hole for as long as possible. The goal is to climb out of the hole. That's what we're looking for. So any activity that you do from a fitness exercise perspective is should be targeted at how can I improve my strength, improve my muscle mass, improve my balance, improve my coordination, improve my endurance, improve my flexibility, improve the aspects of how I use my body every day so that the things that I do, I can do better and I can do by myself where I don't need help, right? The goal is to be independent for as long as possible. That means we have to build our bodies to support the lifestyle that we want to live. Okay. Now, how does that look for somebody just getting started? We talk about there's no expectation of what fitness should look like. Well, I have a lot of people who the biggest challenge they have in their life is getting up and down off the floor. So their fitness routine for the immediate future is getting up and down off the floor as many times as possible in a day until getting up and down off the floor is an easy thing to do. That is fitness. You are taking an intentful, purposeful action to improve your body's ability to function in your own environment. If getting up and down off the floor is hard, then do it until it becomes easy. And then that sets you up for the entire rest of the process for the rest of your life. Because fitness is about making physical movement and physical stress management easy. So what is fitness? Fitness essentially boils down to finding something that's hard to do and making it easy. That's all it is. That's all fitness is. Fitness isn't about weight loss. Fitness isn't about getting big muscles. Fitness is about how does my body move in space, and then how can I make it move better? How can I handle things? How can I carry things easier? How can I walk my dog better? How can I play with my grandkids better? Right? How can I help my spouse or partner or friends move furniture around their house better and not feel like I'm not able to contribute or I feel like crap and tired for days afterwards after I do something physical, right? That's what fitness is about.
So everything you said, let me summarize, see if I'm correct. You can correct me if I'm wrong. uh, doesn't matter how old you are, you can
Not
start
at all. Yep.
now. Now is the best way, the best time to start,
Yep.
right? And it really doesn't matter what level of fitness you have, wherever you are, start there.
There's always
Okay.
something you can wherever you are, there's always something you can do. Yep.
All right. So I'm obviously oversimplifying this, but
No, that's good. That's
it
it.
comes down to
Sometimes that's
it.
the way to go. Yeah, for sure.
Today is the best day. What is the best exercise to do? The one you can do, right?
Yeah.
And
Well, and that's what I'm saying. Identify everybody. A lot of people have something in their life that's challenging to them. And like I said, I've had clients that are like, I can't get down on the floor and play with my grandkids, or I used to garden all the time, but now I can't spend any time in the garden on my knees because I can't get up. I can't get down. My knees hurt. My back hurts, whatever. Right. So it's like, okay, what types of exercises can we do to make it so that you can go back out and enjoy your garden? There's innumerable numbers of things that people have that they want to do in their life that they may feel limited or that they've had to remove from their life because their body doesn't support it anymore. So it's just identify those things that you want to do and start using those as the goals and the guidelines for how you can, put together your training to give you something to shoot for.
So this is a comment from one of the viewers. Of
Thank
course,
you, United.
their family, they're familiar with you, and many people here are. I think they all seen you. Not all, maybe, but if you haven't, I in the description I have a link to your link tree
Okay.
where you can find many of the links you have
Yeah.
there, of course.
Yeah.
And two of the things that you'll find there, I believe, is the first two things are your books.
Mhm.
Um, so why don't you tell us what the title is for those two books?
So I've got the latest book I put out last year, I think it was, is Body Confident. And the purpose of that book is really to help everybody understand what the basics are that we need to address when we talk about how to improve our quality of life. So there's three main tenets, there's three main pillars: mindset, fitness, and nutrition. And you talked about how important nutrition is. And if you ask me what's most important, I will tell you fitness. If you ask me what's most important, I'll also tell you nutrition. If you ask me what's most important, I'll also tell you mindset, because they are all equally part of the puzzle, and you will not sustain success unless you have all three of them. You can make progress on your journey with any of the three, but you're not going to stay there for the rest of your life and understand what you're doing and be comfortable in your body and what your personal freedoms look like, unless you have all three. So I really wanted to give people some insight into what it takes to get there, and then how to maintain it through proper mindset, fitness, and nutrition. And that's what Body Confidence is about.
So I put the link in the description for his link tree. I'm showing here.
Yep.
You're seeing that, right?
Yep. And if you click on,
Um,
scroll down a little bit, and right there, Body Confident is the book I just came out with. And then the book I came out with a couple years ago is the Ultimate Ketogenic Fitness book. And that is really, a lot of my clients over the years have been people who are doing keto or some version of keto, carnivore, something like that. And they've just been kind of sitting around the same place for a couple years, trying to figure out, I can't seem to make any progress. I'm not sure why I'm not getting where I want to go. What am I missing? And invariably, the things that people are missing is something having to do with the way they're thinking about their journey. So mindset, and then fitness, not understanding what fitness is and how it fits into the whole big picture. So the Ultimate Ketogenic Fitness book is really designed for people that may be stuck in their keto journey, and helping them realize how do they take mindset aspects, and fitness aspects, and plug those into the equation and kind of get themselves moving forward again.
and if you don't have the link, I said it's in the description, both Dr. Kill's channels and my channel. I'm broadcasting in both. And even if you didn't have the link, you go to Linktree and search for Coach Bronson, you'll get there.
Yeah, if you just go to Google and type in Coach Bronson, my website should come up, my Instagram, my YouTube, my books, all that stuff should come up.
All right. Uh, let's see. We answered this question. This is a question for you. Sandra asks, how does exercise affect blood pressure?
Yeah, acutely, it will go up a little bit, but over time, you're going to notice in general, it's going to decrease. Exercise is going to help you improve your general blood pressure profile.
And I want you to explain acutely will go up a little bit. Uh, that's a normal response of
Right.
your body when
Right.
you're
Your heart,
exercising.
your blood volume increases, your heart rate increases, your stroke volume increases, everything, like all the pumping is happening. That's increasing the pressure that's on your veins, right? So when you recover, you're done working out and your body settles in. Now you're basically, I like to it, I've never used this analogy from a blood pressure perspective, and I'm wondering if it works. It's kind of like when you blow up a balloon, right? If I blow up a balloon to a certain point and then let the air come out, not much change happens to the balloon. But if I blow it up really a lot and then I let it out, the overall balloon is bigger than it was when it started, right? So there's more room, right?
By
There's
the
not
way,
as much pressure,
that's exactly what happens to the heart.
right? So
Uh,
that's what's happening, right? Your heart is getting stronger. You're able to push more with less pressure. There's a lot of stuff that's going on as you improve your fitness and your cardiovascular fitness that helps reduce your blood pressure.
so the overall
I hope that
effect
answers your
is
question, Sandra.
definitely improving your blood pressure. Exercise is one of the many pillars that you can use to improve your blood pressure.
Yeah.
When I went to medical school, we learned that 95% of the cases of hypertension, well, we didn't know what it was. However, most of those nowadays, we can identify very clearly they are having an excessive amount of carbohydrates. They have high levels of insulin, and
Yeah.
hyperinsulinemia by
Well,
itself increases your blood pressure.
yeah, there's also another aspect I don't know if people really talk about, but when you exercise, you're building muscle and you're doing certain other types of endurance work, you're actually increasing capillary density. So you're creating more points which your body can put blood, oxygenated blood, and present it to muscle and other tissue. So you're actually reducing that. You're creating the space that the blood can fill, right? So the more capillaries you have, it kind of reduces that pressure overall as well.
Okay.
So I hope that answers your question, Sandra. Sandra, not sure which one it is.
Yeah. This is not a question for you, but we started a Kills Health certification course, and there are people talking about others.
Other ones, yeah.
They are all good. It's just uh, I think we're giving away. The first class was only $400. The regular
Okay.
price is $997. It's gonna be 3 months. I'm not gonna teach you how to be a medical doctor. I'm not gonna teach you to be a nutritionist. But we'll give you some skills to coach other people, and so a little bit of the science, a little bit of coaching skills, and we'll have our first graduating class in 3 months.
Oh, nice. Okay.
Because we just started yesterday. So that's what they're talking about there.
Gotcha.
Thank you for trusting us, by the way. And by the way, the other people in the space, there are some. I don't know if you have ever looked into. I know, for example, the simplest program from the Nutrition Network is somewhere about $1,500.
Mm-hmm.
But I've seen some out there for $15,000.
Yeah, that's
Uh,
crazy.
it's
It all
crazy.
depends on what you're looking for, right? Why do you want to do it? If you want to do it for, general information, or maybe you want to start coaching and you want some just continuing or additional training and information, I think, there's different use cases for all the different programs out there.
So let me ask you about your clients. Most of your clients, where are they coming at in the levels of, are most of the clients already doing something very strictly with their diet, a
Yeah,
ketogenic diet or carnivore?
historically, and I'm in the process of changing that right now, but we can talk about that in a second. Historically, my clients are people who have made some initial progress by transitioning to keto carnivore. Um, some of them, when I first got started, a lot of my clients were also first getting started. Um, but over the years, it kind of morphed to people who were stuck. I've been doing keto for 5 years. I lost 20
All in.
pounds. I lost 50 pounds. And now I don't know what to do. What's next? Right. I still have this weight around my belly to lose. It won't come off. I don't know what to do. I feel like I've tried everything. They do all the challenges. They do all the fasts. They do all the this protocol and the that protocol and this program and that program, and they just can never seem to get where they want to go. So I have specialized over the past few years on helping people pull away from all of the expectations that other people, following everything they find on the internet and learning how their own body works and the concepts behind good nutrition and good fitness that they can then apply, because the concepts are always going to work more than any specific protocol or method. And we tend to follow protocols and methods and not really take the time to learn our own bodies to know if that protocol or method is even applicable to us. Right. So that's kind of where my focus has been. Um,
And
Probably 90% of my clientele over the years has been women over 40. That's where that's where I think the largest demographic in this space is women over 40, from all backgrounds. I published my first paper on a case study of a group of women pre and perimenopausal who we used a ketogenic diet and a fitness program to relieve their symptoms of menopause, while improving their lean mass and reducing body fat at the same time. Um, so I have a lot of experience in that area. I'm currently in the process of transitioning, though, to start doing a lot more research and working with athletes. My focus has kind of moved to the older athlete, right? 30, 40, 50, 60 years old, people that have been doing some kind of competitive sport or even just as sport enthusiast for years, who are realizing that, number one, they're not getting any younger. They feel like crap. Their performance is going down in ways that they don't want it to. They've heard that keto is good for health, but that it's also bad for sports performance. And for me to try it. And so my mission right now is to try to explain and educate people on the benefits of a ketogenic diet from a sports performance perspective, while also improving your health. And that's
uh,
kind of where my focus is now.
please expand on that a little bit, because
Yeah.
that is a common uh, comment from people. Or, if you're going to be an athlete, you're going to be competing, and whether it's endurance or whatever type of competition
Yeah.
you're doing, you have to eat 6 times a day. You have to carb load. You have to uh,
Yeah.
this comes, unfortunately, from the world of bodybuilding and extreme sports, where
All sports.
this is a common, I'd say, misconception. But
It is. Yeah.
uh,
It's absolutely a
so
misconception.
how
There's a lot of science that was good for the time that we had it. And as our ability and the time that we spend learning new things has progressed over the years, we still have not, especially in the science community, really accepted some of the new paradigms. And we're looking to change that. I'm actually working on a paper right now that hopefully, when it comes out, is going to completely say, look, guys, here's some new stuff. We've got new information. We need to start using it. That means we need to change this. We need to change this. We need to change this, and just get that out there in the literature, because the way that things are evaluated, and this is part of the problem, there is an abundance of information that unquestionably demonstrates the benefits of a ketogenic diet on sports markers and sports performance. The problem is the way that everybody in the space looks at those markers is through the lens, like you were talking about with LDL, is through the lens of a standard American or carb centric diet. So those markers from that lens don't look good at all. But the problem is it's a completely different metabolic profile that you cannot apply a carb centric evaluation to. You have to either equate for that new profile and make adjustments to the existing pair of glasses, right? Or we need to build a new pair of glasses and start handing out a new set of glasses to people to look at things differently. So that's kind of the process that I'm focusing on, is saying, look, guys, we're looking at this wrong. This is the way we should be looking at things. And if we look at things this way, you can see this next to this. One of these is obviously better.
All righty. Let me see if I miss any questions here. I didn't see Q's, but I think there was a comment here I wanted to. Um, well, let's put this one. Thank you so much for being
Hey,
here
absolutely.
today.
I love doing this stuff. Ask me back anytime.
All right.
Hopefully you guys have some more questions next time too.
Okay. This is an interesting comment,
Yeah.
and uh, basically, my wife told me yesterday after my son's visit to the pediatrician, she said my 12-year-old had to eat more fruits and vegetables. Right? I said, of course she did. Uh, what do you think about this comment?
I think it's ignorant. I think it's uninformed. I think it's a traditional response based on the education that they have, which I think we both know is incomplete. Right. I mean,
Now,
I'm just getting ready to start a doctorate, and I know for a fact that I just finished a master's. 95% of the information I got in my master's, I had to grit and bear it because it was wrong. It was flat out wrong. And I'm not going to get into an argument with my professor and try to change the curriculum at the
no,
school.
if you're in
Right.
school, just put down what they
Right.
told
It's
you
like
to put down.
whenever I had a chance, I would say something and write something and do things to say, hey, I think we need to think about what we're doing here. But when it came to answering, I know the question on the test they want, right? I know what the right answer is, but I'm going to put what they want for the test. But as often as I can, I go in there and I make a noise, I make a stink about something. But
Yeah.
for the most part, it's just grin and bear it. So we know the information is flat out wrong that they're being taught. Um, and
And
most doctors aren't going out like you on their own to figure out, hey, wait a second. The logical, the logical point of view should be everything I'm telling people isn't working. So maybe I should be telling them something else. And many doctors don't make that connection.
yeah. So we know studies show that 88 to 93% of people are metabolically sick. We only 7%, 10% maybe of us are metabolically healthy. So I always say, if you're one of those 7%, keep doing what you're doing. Don't even ask me questions. If you're metabolically healthy, keep doing whatever it is you're doing, keep doing. But everybody else who's metabolically sick need to change what they're doing. And unfortunately, it's not as easy as say, oh, eat all animal or all plant based. Uh, most of us are eating fake food,
Mhm.
right? We go to supermarket and we have 98% of the things that are sold in the big box stores, the supermarket comes in a box, a bag, or a can, and most of those are just not real food, right? So if you're gonna start somewhere, at least make the jump to whole foods.
Yeah.
But then sometimes, if you're not metabolically healthy, then you need to examine what is it that you're eating, maybe decreasing some things. Some people
Mhm.
don't think about bread, pasta, and noodles and things like that being processed food, but it's still ultra processed foods. So if you're, I think, like I said, someone metabolically healthy. So whether it's a child, a teenager, an adult, if you're metabolically healthy, keep doing what you're doing. I, as a physician, I'm dealing usually with not healthy people, but with sick people,
Right.
and you have to make a change. I mean, if you
Absolutely.
don't, if you don't admit to yourself that you have to make a change, then we can't get probably anywhere because we have to be convinced that something needs to give, right?
Mhm. Mhm. Yeah.
Uh, well, we're coming to the top of the hour. thank you for being here, Coach Bronson.
Absolutely. Absolutely.
And even though we already mentioned it, but where can we find you?
Coachbronson.com. That's where all my stuff is. You can
All
get
right.
links to my books, my blog, my YouTube channel, my Instagram, all of it's there.
All right. So coachbronson.com. And that's your, I believe, at Coach Bronson is your YouTube channel, right?
Mhm. And
As
Instagram. Yep.
well. And the link tree, you search for Coach Bronson. Uh, but thank you for being here. We'll,
Real quick, Bill's asking about EKG.
okay. Let me
I'm
see.
not sure. It's really, without going into a whole breakdown of all the different components of an EKG. Basically, a perfect EKG just means that your heart function is normal, right? It's just the beat of your heart, the function of the valves inside your heart, the flow, and the synchronization of when
And at the moment, it's a picture of one moment.
right. Exactly. Exactly. So it's just showing you that the valves and the blood flow in your heart and the stroke of your heart is functioning well. That's all it is. I'm not sure if that's what you're looking for, or if there's something more specific to the question, though.
Sometimes when we evaluate tests, we need to understand what is it that they measured and what their limitations are.
Yeah. So
Because
without going into P waves and T waves and QRS complexes and all of the different how those things all play into looking at what an EKG is, basically it just means your heart is physically operating within the parameters that we would expect it to operate.
all right. So again, thank you for being here.
Yeah, absolutely.
We'll Tomorrow is the 4th of July.
It is.
But guess what? I will be here at 6 a.m. Uh, I don't know who's going to be with me in the morning because Dr. Kills is traveling. He's in. Are you going to Montana?
I am not. I haven't heard about it.
Okay. Steak and Butter Gal has some. It started, I think, yesterday,
Gotcha.
and through the weekend, through Sunday. And Dr. Kills is going to be there, so he's probably not going to be in the morning, but it will be me and Alia. And I don't know the guest tomorrow, anyways.
Okay.
But 6 a.m. every Monday through Friday, we're here Tuesdays and Thursdays in the afternoon. If you're a member of the Kills Mighty Tribe, on Mondays, we did have Coach Bronson a few months ago on the Zoom call on Monday at 5:30, and that is a benefit of your membership. It is free. Just have to go to drkills.com and sign up. The link is in the description for the Kills Mighty Tribe. Anyways, thank you for being here. We'll see you
Absolutely. Nice meeting
tomorrow.
everybody.
And have a great 4th of July weekend. It so happens it's a weekend.